Hi class, this recording is going to be one of the shortest recordings of the semester. We're going to finish up chapter 20 right now as we talk about how we can get blood back to the heart, mechanisms of venous return. So to get blood to the heart or have venous return, we have several factors that the venous side of our vascular system relies on. We rely on the pressure gradient, significant, gravity, skeletal muscle pumps, thoracic pump, and cardiac suction. So let's talk pressure gradients first. When we think of pressure gradients, it's this idea that fluid will always flow from an area of high pressure to an area of low pressure. And we have the lowest blood pressure in our veins. And as that blood pressure, the veins get closer and closer to the heart, the blood pressure becomes lower and lower and lower. So as we look at the high blood pressure on the arterial side and the low blood pressure on the venous side, that's going to be the most important factor for returning blood back to the heart. When we think of blood in the head and neck, gravity is going to push that blood back to the heart. And then we have our respiratory pump or thoracic pump. When we inhale, we're expanding our thoracic cavity. And by increasing the volume of our thoracic cavity, we are going to decrease the pressure in our thoracic cavity. And that's going to pull blood into our thoracic cavity. We also find that during inhalation, we are going to have the abdominal cavity compress a little bit. That compression of the abdominal cavity is going to increase the pressure within the abdominal cavity, helping to force blood upward into the thoracic cavity towards the heart. We find that overall, this thoracic pump causes our blood flow to increase. The velocity of blood flow increases when we are inhaling air into our lungs, or while we are inhaling air into our lungs. Here's another one. This is a fun one to talk about. It's the skeletal muscle pump. Our veins have one-way valves into them. And I need to really emphasize this. These one-way valves within our veins help keep blood flowing up against the flow of gravity towards our heart. And when our skeletal muscles constrict, they bulge and press against the veins, forcing the blood up to the heart. And then when the skeletal muscles relax, those one-way valves close and keep the blood from flowing backwards. Occasionally, these one-way valves in our veins go bad, particularly in the lower legs. And when those one-way valves go bad, we have the veins bulge outward because of blood pooling in them from the one-way valves going bad, and an individual will develop varicose veins as a result of those one-way valves going bad. We also have cardiac suction. As the atria relaxes, the atria of the heart expand, creating a low pressure zone that will suck blood back into our heart, pulling the venous blood back towards the heart. Let's talk about senescence of the cardiovascular system or circulatory system as a whole. And this is going to be for both the circulatory and cardiovascular systems. So for the entire unit one, what happens to the system as we age and lose function of the tissues? Well, in terms of the circulatory system, anemia may result because we have poor nutrition or lack of exercise. There could be disease states initiating anemia, or there can be low amounts of vitamin B12 and the intrinsic factor needed to absorb vitamin B12, or we could have low amounts of erythropoietin. There's lots of different things that could initiate anemia as we age. Thankfully, a lot of those things could be combated with a simple lifestyle adjustment. As we look at coronary atherosclerosis, atherosclerosis is the buildup of lipids, LDL, low-density lipoproteins, within a blood vessel. The particular blood vessels in question are the coronary arteries. So if we have coronary atherosclerosis, that could lead to degeneration of the heart muscle, the myocardium. It also can contribute to angina pectoris and myocardial infarction. These two things become increasingly frequent as we age because we, generally speaking, as we age, have a buildup of low-density lipoproteins within our blood vessels. The heart itself tends to become thinner, and that thinning of the myocardium causes the stroke output or stroke volume of the heart to go down because the heart constricts or contracts its chambers with less force. And as stroke volume goes down, cardiac output goes down. We also find that there can be a degeneration of the nodes within our conduction system, the sinoatrial node and the atrioventricular node. This can lead to irregular heartbeats of the heart or arrhythmias of the heart. We also have atherosclerosis of blood vessels other than the coronary blood vessels. So as atherosclerosis builds up in those other blood vessels, those lipids can absorb calcium and stiffen and cause arteriosclerosis as those vessels stiffen, and they lose the ability to expand. And if this happens with the elastic arteries, those really big arteries really close to the left ventricle, that means that individual is going to have a harder time accommodating for systolic versus diastolic changes in blood pressure. But even if it happens to the arteries at large throughout the body, that means that individual is going to have a harder time adapting to fluid volume fluctuations in their body. Flexing or relaxing our blood vessels is one of the ways that we help account for dehydration or overhydration in our body. We also find that our arteries become weaker, and that weakening of our arteries causes them to become more likely to stretch out like an overinflated balloon. That's an aneurysm. And an aneurysm is a blood vessel that's just ready to pop and burst. And we also have an increased risk of stroke as we age. A stroke is going to be an infarction of the central nervous system or the brain tissue. So we're going to have tissue death of the brain due to restricted blood flow to the brain. As our veins have their one-way valves become weaker, they go bad at an increased rate and contribute to an increase in varicose veins. So that's all we have for this recording. If you have any questions or comments, please feel free to post them in the class discussion board. And as always, happy studies.